Today we welcome Jax into our hospital for his annual dentistry. In order to help you understand the process better, let's take a look at what happens when your pet is admitted for a dental procedure. First, your pet is admitted by the veterinarian. She will check your pet's temperature, pulse, respiration, and color of the gums to ensure your pet is feeling well enough to have the procedure done that day. A blood test is done to evaluate your pet's internal health and to tailor the anesthetic plan to your pet's needs. Next, your pet is given a sedative. This helps calm your pet and also contains pain medication that will be helpful if your pet needs extractions. Once your pet is calm and sleepy, an intravenous catheter is placed. This allows us to keep your pet on intravenous fluids, which helps keep your pet hydrated and keeps the blood pressure from lowering during anesthesia. It also ensures there is access to a vein if needed in the case of an emergency. Emergencies are rare, but we need to be prepared in case they happen. Although there is always some risk when using an anesthetic, it is much safer than in the past. The risks are controlled thanks to new, safer anesthetic drugs, careful dosing and administration, and constant monitoring of pets during anesthesia. Once the catheter is placed, your pet is anesthetized with an intravenous medication. An endotracheal tube is then placed to allow your pet to breathe oxygen and anesthetic gas. Your pet is now hooked up to monitoring equipment including ECG, heart rate, blood pressure, and oxygen saturation monitors. The respiration and temperature are also monitored. Your pet is kept warm with warmed IV fluids and a heated blanket. Now the dental procedure can begin. First, the technician probes and charts your pet's teeth. This information gets entered into your pet's health record and allows the technician to know if any teeth are likely to be extracted. If there are any teeth that may need to be extracted, the technician will give a local anesthetic to freeze the tooth so that it is ready by the time the veterinarian extracts it. Next, your pet will have full mouth x-rays done to allow us to visualize what is going on under the gum line. These are very important because they allow us to find problems we might not otherwise find, such as infections, cracked roots, or unerupted teeth. The teeth are then scaled with an ultrasonic scaler. All surfaces of the teeth are scaled above and below the gum line. The teeth are then polished with a fluoride paste. If extractions are required, the veterinarian will now move on to removing the teeth. Depending on the health and size of the tooth, the extraction may be simple or may require surgical extraction. A surgical extraction involves incising gum tissue, cutting the tooth into 2 to 3 pieces, and removing bone overlaying the tooth root. Once the extractions are done, the technician will do a final rinse with an antibacterial solution. The anesthetic is then turned off. Your pet is allowed to breathe 100% oxygen while it recovers for 5 minutes before being transferred to the kennel that has been specifically prepared for your pet. An assistant will stay with your pet until he or she is awake. If your pet had extractions, post-operative pain medication is given to ensure his or her comfort, and your pet will be sent home with pain medication for the next few days. Your doctor will have another listen to your pet's heart to ensure they are okay to go home. Your pet will be scheduled for a recheck appointment 1 to 2 weeks after the procedure to allow us to have a look in your pet's mouth and assess healing. A technician will show you how to brush your pet's teeth and discuss other ways to keep your pet's oral health looking great after the dental procedure. Dental plaque only takes 36 hours to form, so it is very important that you continue to take care of your pet's teeth at home.